few years ago, we had a great privilege at the University of Massachusetts Medical School to welcome the president of Liberia, Ellen Johnson Sirleaf. What I found was a committed, engaged, and truly exceptional leader. In fact, she had just won the Nobel Peace Prize. She talked in our home about how wonderful it was that her country was now seeing a renaissance, if you will. It was seeing a rebuilding. Torn by civil strife for many years, those days behind them, it was now possible for children to return to school and commerce to be rekindled. There was hope in their nation. Now with Ebola, many, and in some cases greater challenges are facing their country. We feel especially privileged at the University of Massachusetts Medical School to have had a long-standing relationship with the people of Liberia, the government of Liberia, and the educational institutions that reside therein. We partner with Liberian colleagues, and we have felt extremely moved since we began hearing the stories of Liberia and how it's affecting our colleagues and their fellow country people. This week, in a letter to the world, President Sirleaf said that it's not possible for the world to simply pull up a drawbridge and wish this problem away. In fact, the problem of Ebola in Liberia and in other African countries is indeed the world's problems. In every way, our faculty and engaged community are committed to helping the people of Liberia and those affected by Ebola, and we look forward to partnering with the Paul G. Allen Family Foundation as we take perhaps small steps, but indeed extraordinary efforts to try to help the people of Liberia find their way to that bright and happy future with great promise that their president so wished for. There is a great desire for us to get to work, but resources are limited, and the great challenge of dealing with Ebola is before us. But there's a way that everyone can help. It's possible for people to just do a simple thing like log onto our website, umassmed.edu/Ebola, and if they're interested in helping, to make a donation. Each and every dollar will help, and we would be most grateful to receive any generosity that people can bring forward to us. The reality is, men, women, and children of Africa, and indeed in Liberia, are dying in the street. As clinicians, it's very difficult for us to watch this happen and not respond. In medical school, we teach clinicians to go towards patients. Our medical school is now going to go towards Liberia and do everything we can to help stem the tide of this most challenging disease. Any way that you can help us in our efforts would be greatly appreciated.